Okay, this is Dr. Al again. Now we're going to talk about dose response curves in this short lesson on toxicology fundamentals. So since Paracelsus first wrote that the dose determines the poison, remember I said translations vary on that, humans have recognized that when you are exposed to more of a toxin, you will have greater adverse health effects. Right, and people know this. So if you think about just day-to-day living, if you think about if somebody consumes alcohol, right, the more alcohol you drink, the more effects you have from that, the consumption of alcohol. And if you keep drinking unchecked, you will actually poison yourself, and you can even kill yourself that way, right? So we know that the dose determines the poison. This relationship, this reality, is formally called the dose-response relationship. And it means that the greater the level of exposure, the greater the absorbed dose, and therefore the greater the negative impact when we're talking about toxicology. Studies of dose and response are used to help establish that a particular toxin causes a particular adverse health effect. For example, research that looked at dose response curves is some of the research that established that smoking causes lung cancer. More smoking causes higher levels of cancer typically, although not always, because cancer is a little bit tricky, and we won't get into that here. Studies of dose and response are used to determine at what level a toxic effect occurs to allow us to set regulated levels for particular chemicals. And these sorts of studies are also used to determine the rate at which increasing exposure causes increased negative effects so that we can model the potential for harm and hopefully mitigate it. Now, one thing that is true is that different people in a population will vary in their response to any given chemical. So not all bodies are equal. There are differences in the sensitivity to chemicals between male and female bodies. There are differences according to body weight and size. There are differences according to age. Children being typically much more susceptible than adults to toxic effects of various chemicals. There are differences according to genetic background, right? So not all individuals will respond in the same predictable way to a particular chemical. However, if the chemical is well researched and we have a lot of individual data from a large population, then we can plot that data where we have numbers of individuals on the vertical axis and we have the response to the chemical, whatever that is, right? And each chemical will cause a different sort of response or set of responses. And if we plot that data, what we will see is that the majority of people, if we determine the mean, right, will fall at a certain level of response, with some people experiencing more severe responses and other people experiencing or milder responses, or maybe even none at all, right? But most people will fall within 1 or 2 standard deviations of the mean. This will be a bell-shaped curve if you have a large enough population, and this will tell us information like the broader this curve, the greater the variability in response across a population, right? The narrower this shape of the bell would be, then the less variability there would be for a given population. So we can get a lot of information in understanding chemical responses by different people by plotting, getting a lot of data and plotting it to look for this bell curve. More specifically, we can also, in research, we can do very specific research where we look at the response, plotting on the vertical axis, relative to a dose. Okay, so let's break this apart a little bit. This is a dose response curve, and it is a dose response curve taken for 2 chemicals, chemical A and chemical B, and this is explained in a video within your reading linked for this course. Okay. The Tox Tutor reading that you were linked to. So across the bottom axis, we have absorbed dose in milligrams of chemical per kilogram of body weight. Okay, so it's a concentration. The milligrams is how much chemical. The kilograms is like per body weight, okay? The response is some kind of toxic effect that is being measured, okay? And so what can we learn from this? Well, in general, the curves are going up and right? So we see that greater doses are leading to greater responses. The dose determines the poison, okay? And that's what we're seeing here. We're also seeing for each chemical that there is a point at which if we're starting to experience the chemical, there is no response. And then there's a point at which we see a response. We see a toxic effect. That's called the threshold dose. And it's different for these two chemicals. So the threshold dose for chemical B is lower than the threshold dose for chemical A. So if you're just looking for any effect at all, any toxic effect at all, right, you're seeing that the individuals that were tested here are more sensitive to chemical B than they are to chemical A when we just look at threshold dose, okay? Next, we're going to look at the fact that these curves are shaped a little bit differently, that the one is steeper than the other, and we'll talk about that. Right, so here, if we pick one concentration and we say, okay, what happens when we're exposed to 100 milligrams per kilogram body weight? And what we can see here is if we plot that, right, we go up and we look at chemical A, we can see that like between 75 and 100% of individuals are showing a response, whatever the response is. There'll be one fixed response that is measured for determining this. But we're seeing quite a large number of this population is negatively impacted. These test organisms are negatively impacted by chemical A. Whereas at 100 milligrams per kilogram dose for chemical B, less than 25% of the individuals tested showed the effect, right? So it might be easy to conclude based on that chemical B is less toxic than chemical A. However, we remember from the previous slide that the threshold dose was lower for chemical B than it was for chemical A. So really what we can conclude is they are different. And by determining dose and responses, we can better understand and study each single chemical. If we zoom in on like this area of the response curve, dose response curve, we can put additional information to this. So I defined threshold dose a minute ago as like the concentration at which you first start to see a negative effect. Just prior to that is something called the no observable adverse effect level, right? And that's something we can also determine from dose response curves. The threshold effect is pretty much synonymous with the lowest observable adverse effect level, or the LOEL, right? They mean about the same thing, right? And then an additional thing we can get from some dose response curves, if the response was death. Again, if the response or endpoint for the study was death, where we dose a bunch of organisms and we look to see when death occurs, right? Then we can determine from a dose response curve like that, we can determine something called the lethal dose of 50%. What concentration of dose, of absorbed dose, causes mortality or death in 50% of our test organisms? The LD50. It's a pretty severe endpoint, but still, it's useful. Endpoint is a really important thing to know when you're looking at dose response curves. So it depends on your endpoint where the curve will fall and sometimes what it will look like. So we just looked at an LD50. So for this curve right here, that would be where the endpoint was death, right? So there will be a threshold or a lowest observable effect level where we see the first death occur. There will be an LD50 where we see 50% of the population of the test population is dead, right? And this is based on research. Obviously, we don't do this kind of research on humans. TD50 is the toxic dose. So here we would be looking for some adverse effect other than death, right? And so we're just looking for toxicity. And that would be a different endpoint. in here we've got ED50, and in this particular slide it's defined as the therapeutic window. So these would be curves for something that at low enough concentrations is helpful to you, but at high concentrations can actually kill you, like aspirin, right? Or alcohol, well, no, like aspirin. Let's stick with aspirin. So the ED50 is the effective dose for 50%. So each curve is different, even though they're measuring the responses to the same chemical, because they're looking at different effects or endpoints. All right, so this is related to something called therapeutic index and the margin of safety, which we will get to in a later part in our course, but we're not covering yet. But these dose response ideas are really important for that. So with that, I'm going to conclude this lesson.